new dentists come out exactly like what Alex says. Someone told me that if I go mentor with someone, in 2 years they're giving me their practice. Let me tell the world, no one is giving you their practice.
All right, so I know I've complained and I've made you aware of our current situation at one of our offices, right, Alex?
Yeah, which one of these again?
The one that I'm working at.
Not which office, which problem.
Oh, which problem? Yeah, the many. Yeah. No, but the main one we have going on right now is our associate doctor that's been there for a few years, right, which is great. He got into endo school, which is awesome. Well, that starts in a few months, and so he was really good about letting us know he was applying. It wasn't anything like he just sprung on us at the last second, so we had a lot of time to prepare. But that date is like mid-May.
Have you been preparing?
I don't know. I mean, no. The DSO is supposed to be preparing.
Okay, so you got to hire someone new.
Yeah, we need to hire a new associate to come in to our office. So, the one nice thing I guess about selling to a DSO, or if you're not the majority owner anymore, is like ideally that stuff is kind of put onto them. So a lot of like the initial hiring stuff, the finding the candidates, all that kind of stuff they've been doing, and then just pretty much vetting people out and saying, hey, do you want to meet this person? Mm-hmm. So we have a person coming in next week to check out the office, which is good. Yeah. But I'm already in my head thinking like, I know basics on what they want, but I'm already kind of writing down my questions of like what their goals are, what their expectations are.
Now, have you reviewed like the resume? Did you even know like anything about this person yet, or is like pretty much here?
It's a dude.
Okay.
And I know he had been working here before in Denver prior. And he's looking to work. He's willing and able to work.
He's breathing and he wants to.
He's a body.
Wants to be.
Although I feel like in Denver we shouldn't have that big of an. I don't know. In my head, I think a lot of people are still moving to Denver, so I feel like there should be lots of people. But I wanted to bring on Sari because she deals with a lot of things all in dental, but one of those things is definitely with recruiting, right? Like she helps either kind of on both sides, right? She'll help out associates looking for jobs or owners who are looking for associates, right? And so I wanted to kind of frame this episode around, I guess our situation, what we're dealing with, kind of find out from her what she sees right now as like what associates are looking for, right? Like, so maybe I have a better idea of when I talk to him, like, what questions should I ask? What should maybe some of my expectations be? What are some red flags maybe I shouldn't say, right? So thanks for coming on. We appreciate it.
Thanks for having me.
And just as a shout out, thank you. Thanks for having us on your podcast. So we definitely had to do the unspoken get on each other's podcast thing. So thanks for having us on a little bit ago.
Thanks for having me, and thanks for coming to mine. The associate world seems to be getting such an interesting topic matter for everybody lately because everybody's looking to hire, and right now, you guys are in hiring season. I mean, you've got a bunch of new grads and coming out of school really quick. And when I'm talking to them, it's really interesting, like sort of what they're looking for is maybe a little different than what we think they're looking for.
I'm curious on this. Yeah, so let me know.
They do not get what they need in dental school. I mean, think back to when you guys graduated. You were probably ready to come out and drill teeth and work with patients and do a little bit more complex treatment plan for somebody. And these guys come out and really, they're at a loss. COVID did not do wonders for education in the dental community, really, truly. I think you're getting, and these guys that you're getting now were at the end of COVID, right? 2022 to 2026. They really, I look for different things. I'll tell you, I want somebody without a lot of residencies. I want someone to go to a dental school that doesn't have 10 residencies there, where they're competing to get an endo, an oral surgery, prost, that sort of stuff. I really want guys that have gotten in there. They've got grit. They've seen a lot of patients.
Are you finding, so a good backstory on that, because like when we went to Indiana and graduated in 2013, I remember we used to have to fight over a lot of implants, right? Even if it was just restoring the implant. So like, I don't think we came in, you really had to push and like, if you wanted to place implants, you were going to go talk to the OS department or, perio. and they would maybe let you shadow and do stuff. And then if you wanted to restore, it was like you'd have to deal with pros, right? Is who you'd have to deal with. But I know our school had a lot of those specialties, and that was, I mean, I get it. There's only so many patients. And I remember we were, I don't know if forced is the right word, but like strongly encouraged that if there were implant candidates or anything like that, it was like you kick that up to the top floor, right? Because that's where the residents get that stuff. And I get it. They're paying and they need to get paid, right? Or they don't need to get paid. The school needs them to get cases so they can get experience, right? And so it kicks the can down to the next person. Now, I have heard, and I don't know if you know this or not, I've heard some of the newer schools that have opened, like Midwestern, the one that's in like Arizona, or there's one in Chicago too. I've heard good things about those schools making the dentists, like just the graduating dental students, have a lot of clinical experience.
I will literally have clients tell me where not to go. And I've had 3 or 4 clients tell me, I want a Midwestern grad. And I'm actually have a client that I'm doing a build out for right now who's a Midwestern grad. And he's going into a subspecialty of exodonture. He is just literally going to take out teeth. And he's like, I'm like, well, how did you get good at this? He's like, I did so much of it in dental school that I'm not afraid to touch anything. If it's next to a nerve and I have a CBCT, I'm not afraid to touch it. And I'm like, you're not sending that stuff to the oral surgery? He goes, why would I need to? I had so much experience with it in dental school, and I had great professors working with me and talking me through the process. So I think what happens is it where you go to school does matter, but the big name schools, they're great when you're going for a residency. I'm never going to say anything bad about you get into dental school, you're a smart cookie, period. But where you go and the experience that you have with patient time and actual hands-on experience is going to be the game changer for you when you are going into the workplace. And a lot of employers now are very well aware of that.
Yeah, I mean, Alex, so like in our situations, right? Like I went the military route. So like I kind of saw that as my experience. I did not end up doing like a GPR or an AEGD, but I got lucky and I got stationed at the same clinic with all the AEGD residents, and there was a periodontist, there was one periodontist, 2 oral surgeons, an endodontist, a prosthet. There was like everyone, right? Even like an orthodontist in the military, right? Like, and so I got to kind of just shadow and follow them. Didn't get the same experience level. Like they all got to do way more than I did and build their skills more. But Alex, you went straight from graduation and went into an associateship. So did you feel like when we graduated, how did you feel like coming out of dental school?
Yeah, I felt comfortable. I didn't feel, and I think in our class, like it wasn't the majority of people went on to a GPR or AGD. Like it was just.
It wasn't as common back then. It seems like you're right. It seems like it's way more common.
At least for our school. Like I'm sure there was other schools that's what you did. Like that was like the next step. But I feel it was like definitely less than 50%. And I felt fairly confident that if I didn't learn something at school, I would figure it out. You know, I would just like figure it out on the fly.
Yeah, you were easier with like confidence with that though. Like you're more like, you have a little bit more of like the cowboy or cowgirl attitude of like, I'll just go in and I'll do it, right? Versus like I need to be handheld. I probably wanted to be handheld more, right? Personality wise, whereas you'll go do it.
Yeah.
But I think the other thing too is maybe it depends too on the makeup. It probably depends on what school you're at and like the makeup of the students, right? Like we were in Indiana, right? There were a decent amount of kids that were going to go back to their dad or their mom's practice, right, in small town Indiana. So, you know, they knew, like, maybe I don't need a GPR or an AEGD. Like, my dad's going to mentor me, right?
They had a built-in mentor right there.
And they had that. And I wonder if you're at schools that are more like an NYU or like a big school that maybe has a melting pot of people from, like, all over, if those schools maybe try to push, maybe don't push, but maybe more students go into residencies because they don't have that support right after where they're like, I'm going to learn from an uncle, a dad, anything like that, maybe.
I mean, I will even tell people when I'm now I have the weird phenomenon, right? I've got a lot of people that are coming out of school that'll come talk to me just because they know I will talk to them and tell them what the reality level is. And I will say to them, did you think about doing an AGD or GPR? And they're like, well, why would I do that? And I'm like, because when you're a dentist, you're like MacGyver. You're going to open something up and you're not going to know what you're really looking at. Even if an x-ray gives you, some idea. You don't know what always is going to be in there. You don't know what you're dealing with. Sometimes you've got to ad lib your approach, like what you're saying that maybe Alex would be doing. And for me, I just look at these guys and I'm like, look, you want to be the best possible trained dentist that you can be. So why wouldn't you go get that extra year of training? One, you're getting paid for it. Two, it looks amazing. I mean, I would rather have somebody that has 4 years of dental school and a 1 year GPR program, AEGD program on their resume than somebody who just went to 4 years of dental school. Even if I think they went to Midwestern or ATS, AT Still, or any of those schools where they're just doing, dentistry, they don't have any residency programs, that sort of stuff. I still would want somebody that has that extra year of patient contact, because when you're doing an AEGD GPR program, especially GPR program, you're seeing like trauma stuff in a trauma center. Oftentimes a veteran affairs is very involved with that. And so you're going to see stuff that you may never see anywhere else. You might get in there and see someone has like an incredible amount of bone loss or doesn't, and you're going to get a new experience that will help you later on when you have patients. And the other thing is, I think when you go do those AEGD GPR programs, you become humble to the point of trainable, coachable, teachable that I can't even begin to tell you, because you see stuff that you will not see in a regular dental office. Obviously, you're going to see unbelievable trauma. You might see somebody that comes in with a head and neck tumor, because those are facilities where you're going to see stuff like that. So you're going to see other medical comorbidity type of stuff that you won't see in a general dentist office. And now you're going to learn how to deal with somebody that has multiple things going on in different systems that you may have not been exposed to before, like a cancer patient that's going through, mouth radiation. What are you supposed to do for this person to prep their mouth so that when they're getting radiation, they don't lose their teeth, because there's a very high risk of bone loss from the radiation, like those type of things. What are you doing for those people? You're learning things that you wouldn't normally learn. And I think that just makes you overall not just a better dentist, but an incredible human being, to have a level of compassion because you learned something else, not just related to oral health care, but related to overall health.
Yeah, I think like if I was going to go back and do it again, right? If I wasn't doing the military route, which I would argue for people, if you weren't like, I have a hookup where I'm going into my uncle's practice, I'm going to buy it in 3 years and he's going to mentor me, like that's probably like ideal for some people, right? If it's an easy, it's probably like one of the path of least resistance, right, is to do that. But if not, with how expensive dental school is now too, doing the military, right, isn't a bad thing if they're going to pay for all your school. Or then I would say do a GPR AEGD. Like if I didn't do the military, I think I would be way more effed if I like just went out after 4 years.
Really?
Yeah, compared to you, I would have.
Yeah. I don't know. I think it all depends. Like there's no like straight, like everyone has to do a GPR. I don't think that's true. It's not for everyone, but yes, there is tons of value in getting more education, obviously. Like even if it's not like if you're in trauma and then you go into like a bread and butter dental office, that's maybe you don't, that skill of putting someone's jaw back together or whatever it is not going to apply, but still dealing with people,
right,
dealing with working with others and like all those other skills, like some of the soft skills and stuff, and all that's valuable no matter what.
Yeah, even if you're like eating shit though, like at the GPR, like it's good because you almost see like way worse things, and then you come to a general dental office that's
and
bread and butter.
You get your stress, like you know how to
and as an owner
deal with stress.
But as an owner, what do we do? The two associates that we've had that have lasted really long both had GPR residencies, right? And what was nice is they came in and they both were comfortable and didn't need extra training, didn't need someone over their shoulder on taking out thirds or doing,
or even any of
endo,
the easier stuff too. It was like, oh, I've done this. So hence, doing a class 2 on a, tooth is like a cakewalk. So I think it really just depends on your skill level, like, and how you feel comfortable. If you're walking out of dental school and you're like, I can do this, like I'm comfortable doing all of this stuff, then you really need to think, do I want to, not waste another year, but it's like, do I really want to delay, just, whatever your goal is, if it's opening an office or just, associating or whatever, you might need to,
okay, so
think
like,
about.
This is what my one buddy, I just had a conversation about this with my buddy, like literally 2 hours ago. Yeah. And he's looking, same thing. He's transitioning out of his office and they're looking for an associate to kind of take over his role. And he's kind of been the leader of the practice. So, the DSO he's with had sent him a couple candidates, but they were both, 2 years out, no AEGD or GPR. And he immediately was like, nope, man, that's not going to work. We're a fee-for-service practice, right? And we do a decent amount of dental. Like, we don't keep everything in-house, but he'll do, like, sedation, right? Not, like, IV sedation, but conscious sedation. He likes to do endo. They'll do some oral surgery in there, too. And he's like, I don't know, 2 years out, that just seems... In his head, this is what he said. He's like, that seems like an Aspen Dental or a Pacific Dental dentist that just graduated school. Mm-hmm. And at those offices, a lot of times, they don't let them do a lot of... It's almost like an extension of dental school, because I know, like, when I worked at Pacific Dental, and maybe it's different, whenever you got any perio case or oral surgery case, it was quick to send them to our oral surgeon that comes in twice a month, right? So you didn't really get a lot of opportunity to expand your skill set in those. So he pretty much was like, hard no, I want someone with a GPR or that has been out at least 5 years. That was like his requirement. And I feel like that's what a lot of owners are looking for now, because I don't know if this is a kind of a good segue for it. When you talk to owners, do you find they're as open to wanting to like spend time training and teaching as they were in the past? I feel like we're not. I feel like we're way more just like, I want to hire someone, you come in and work. I have like 10 other fucking headaches I have to deal with, and I don't want to add this to my plate.
I have owners that'll literally say to me, I will spend 1 month just mentoring this person because I want them to do things my way. Because I have had owners say to me, I hired the wrong associate. And I go, what does that mean? And they're like, I hired an associate who did a lot of dentistry, and every single patient they touched is a retreatment for me and back in my column, which is like the very reason you hire. I would rather someone slow. I would rather they didn't do it fast than to have my doctor now, who produces like a couple $1 million worth of dentistry every year, now have to produce another $500,000 or $600,000 worth of someone else's mistakes because they were quick, because they didn't really know what they were doing, and they didn't have the humility to ask. They just went ahead and did. And then now I got people coming in that may have come in for an MOD, and that MOD wasn't done right, and now they're getting a root canal from me. Like, that is a worst case scenario. That is, you are not doing your job well, which means if you're a really good dentist and you want to develop somebody, you're going to have to develop them yourself and hire somebody who's trainable, teachable, coachable, because you're going to spend some time training them, teaching them, and coaching them how to do the right thing. We are constantly learning and evolving. You think my 67-year-old dental friend, who is one of my dearest friends, is doing implants? He's like, I got no need for implants. He goes, I got so much bread and butter dentistry, I don't have to learn how to do implants. I'd rather hire oral surgeon to come in my office once or twice a month, place the implants, and I'll restore them. What do I need at this point in my career? I mean, it's interesting to me. Do I know a lot about it? Yeah, I understand it. Could I make more money? Sure. But I really like doing what I'm doing, and I don't want to do root canals. He drilled it. This is my personal dentist, but he drilled into my tooth. He was cleaning up someone else's mess from a crown. They didn't do the margins right. He popped the crown off, was cleaning it up, and I was totally frozen, and I nearly jumped out of my skin. And he's like, I love you, honey. You need to go to the endodontist. And I'm like, no, can't you do it? And he's like, I don't do endo. You're going to the endodontist to get this fixed. I would have been happier had he already had my tooth open and been able to do the endo right there for me on my, molar. But I went to the endodontist, got it done. But the person that I went to was this prosthodontist who was the best of the best, putting my crown in my mouth that he is now fixing. And it was a problem. So they really didn't know what they were doing. I mean, the average public person doesn't really understand something. The person working in your mouth, there is disease in your mouth. They are fixing the disease. You want the best possible trained person who has the mentorship from the people of the office because your brand is your guarantee that it's going to be done right. Not somebody that's going to need to come back 6 or 7 times. And then what do you tell the patient when they come back? After the associate's already worked in their mouth. Oh, I suck at hiring people. I hired somebody who I thought I trusted, but clearly I didn't.
Yeah,
What
did you have to say, Alex? Because like with our first associate, I know the one associate we had first, there were some similar issues to that too, right? Of or the biggest thing too we noticed was like, and my buddy's going through the same thing too, and we went through that on the first associate. It was changing your treatment plan like 3 times, and it's like when they come in and they're like, either the hygienist or the assistant is like, I see a big crack here. The doctor's going to take a look at it. He may say, or she may say, you might need a crown on it, right? Not diagnosing, but just like kind of like preheating the patient, right?
Warming
like telling
him
warming him up. Yeah. And we had one associate that would always like backtrack and it's like, it should get a crown. It needs a crown. It's got cracks in it. And you went back and were like, oh, let's just put like an MODBL filling.
This is what would happen.
Okay, yeah. All right.
Because I was there.
Yeah, you were there.
actually there.
Yeah.
There'd be 3 treatment plans presented to the patient.
1, 2.
Because you'd be like, well, we could do this one. This is the crown. This one is the filling, and this one's yeah. It's kind of like, why are we treatment planning 3 things? 1, you're wasting my front office's time. Like, why are we doing all of this work? And it was just like they were just so indecisive of like, I don't know what to do, so I'm gonna like present them all, and I don't know, like maybe it'll like magically come to her, like, oh, this is what we need to do, or maybe like the patient will be like, of course I'll do the most expensive one. Like, no. So I remember going through that and being like, no, you have to decide like which one are you doing?
Well, the patients are looking for you as the expert, right? So I think in dental school, one big disconnect is we're always taught in dental school, you have to give your patients all the options, right? Like go through every little possible thing and give them the 6 or 7 different things they could do, right? Like literally, like you have a filling in a tooth. Oh, well, we could extract all your other teeth and do a denture on it, right? Like that's an extreme example. But like my point is they go like so into the weeds on you have to do that. And I think to a certain extent, yes, you need to tell people their options. Like if there's a missing tooth, you can, and they have an option for a bridge, you could say you can do a bridge or an implant, but you can tell the patient what you believe is probably the best treatment for them, right? Like you don't go to your doctor if you need some type of like big procedure and they say like, well, you pick what you want to do here. They might give you options and tell you stuff, but they're going to guide you and steer you towards what they think is the best because they're the experts. So I think for associates, I think they need to have that confidence of like, this is what I think is the best solution for them, and that's what we're going to talk about first. And if they don't want to do that, then we can talk about other stuff. But I don't like the idea, like you said, of like 4 different treatment plans, right? It just confuses people.
So confusing. Yeah.
If you like our podcast, check out Alex's newsletter, Just 2 Minutes. It's full of great advice, which makes sense considering it's her thoughts and not me sidetracking her every 2 seconds. You can subscribe at coupleofdentists.com. The link is in the show notes. Now, back to the pod.
When I'm interviewing, I have to tell you a funny story. When I'm interviewing a doctor, I will say, my car's broken. I liken the mouth to the car because it's really clear and cut clear. So, my car's broken. Are you going to patch and fill my car so that I'm going to keep coming back and it's going to be broken? Are you going to tell me what it's going to take for me to have the confidence to drive my car so that I'm not on the side of the road flagging somebody down with a broken car? I mean, fix the problem. Don't patch and fill the problem. Like, you're not going to the mechanic and they're saying, oh, you need a new oil pan. But here's what I can do for you because I know you're on a budget. I'm going to give you this used oil pan, but I know that you're going to be back in 6 months with more problems. Or I can just charge you the right amount of money for the new oil pan, and you won't have any problems for 5 or 6 years with it. I mean, you've got to teach people, stop thinking about their wallet and think about their overall aggravation and health. Because you guys know, I'm sure both of you have had a bad tooth at least once in your life. I mean, It's the most painful, uncomfortable, god-awful. It is next to your central nervous system. Fix the problem. Like, you can't give someone 3 treatment plans. Just fix the problem. Tell someone what it's going to take. This is what it's going to take to fix the problem. I'm happy to do it today. I can put you in the schedule for tomorrow. There's no thinking about it. Your option is we're fixing the problem. There's no
Well,
option.
the type of patient too, right? Like, because this goes back to me, because we always joke that like I'm pretty cheap about stuff in general. So like when you went to the car example, I'm like I'm the asshole that goes there and I'm like, I don't want the new oil pan, I'll take the used one. But then this is okay. So here's a good example though. But I'm also the jerk that then gets frustrated when it breaks down 6 months later. So I'm not a good patient for like the mechanic, because I'll get the cheap fix and then get frustrated when it breaks again and still like blame them, right? So it's like
Do you
that's
want to start selling
that's
a lot of dentistry or teach people to? Ask them one question when they sit down. What's more important to you, your money or your time?
yeah.
That's all you got to ask them. If your money is more important to you, I'll fix it 5 times. I'm still going to get I'm still going to get a crown out of you, but I'm going to get an MOD first. Then I'm going to get my crown. Great.
Yeah.
And if your money is more important to you, if your time is more important to you, then I'm going to fix it right now, and we're not going to have a problem, and you're not going to be back in my chair other than a couple hygiene visits.
Yeah, my point is like the patch patients are usually the biggest pain in the ass patients anyways. So like whenever it's like whenever you're trying, it's like the 20% of patients that are like that, they're the ones who cause you the most amount of headaches anyways, and they tend to be, which I'm guilty of it too with cars, is the person who just wants the cheap fix, right? So like you tell the person if they need a crown, and if they don't want to do it, as long as they understand the consequences, all that kind of stuff, and you don't give in when someone says, can you just patch it up, right?
Right.
And if you're like, no, I can't. I trust me, I get it. It's more expensive. It's more time to do a crown, but I want to make sure your tooth is healthy. You let us know when you're ready to schedule it, and we'll get it done. And you know what? If I was at a mechanic place and they told me that with the oil pan example, I'd probably be more likely to pay for the oil pan, because I'd be like, okay, this person's not effing around. I can't like weasel my way into getting something cheaper with them. And I know like that like I tried and it didn't work. And I actually almost get more confidence in that person, right? So and that's why I think it probably worked with Alex more so with treatment planning than myself, because when we were like your amount diagnosed or amount accepted, even if our amount accepted was similar, the amount she diagnosed was always more than me, because I think you didn't like try to appease every patient. It was just like,
no, I never gave the option. If they needed a crown, I needed a crown. They never even heard the word filling come out of my mouth. That wasn't an option. Why would it? Like so yeah, it would be very few and far between when someone like had a little bit of dental knowledge and probably a previous dentist who had patched something up that they would say, hey, can we just like fix it like this?
I also don't want to be that person too, like, because I think I care about what people think. I always am like, God, if I put like this big ass MODBL filling on tooth number 2, like in the very back top right of their mouth. Fuck, when I like, I don't know, when I move or I retire or something happens, right? I don't want to be that dentist's when they go to their new dentist, right? And that new dentist looks at that filling and is like, God damn it, I gotta crown this freaking thing. This thing's gonna suck. That it's like, oh man, I was the one that put that filling, and that's gonna be hard. Because all of us as dentists know when we get that tooth and you see this big metal filling on it, right? And it's below, you can't even see where it goes down to because it's so far below the gum line, right? And it's just this big metal filling, and it looks gross, and you're like, God damn it, who placed this thing? I'd rather they just put the crown in the first place, right? And you're like, now I gotta fix this. And so like you're like, can I charge him more for this, because this one's gonna suck?
But you also
yeah.
Don't you feel like you lose a little credibility when you're doing the soft sell of, well, I can do this cheaper route? They have to come back and get it fixed again, and they now have seen that you're going to acquiesce to doing a filling when you know you need to do a crown, and maybe they have insurance. Now an insurance company is questioning why you're not just putting a crown on that too. You're setting yourself up. It's not just health. It's liability. It's lots of different things. It's not just one thing. It's like train the dentist to diagnose the problem, treat the problem, stop giving to we as a society, we have decision making like all day long. Make the decision for us. You're getting a crown. It's going to be, you'll be in and out of my chair in an hour. I have a steric machine, you only have to come once, but I like to send these off to the lab, so I want you to have a better crown that's going to last longer, so I'm sending it off to lab. I'll see you in 2 weeks. Here's your temporary. Have a great day. Bye-bye. Is a nice way to say, I'm taking care of it, versus I'm leaving you with a problem. and you're teaching the associate that it's okay to treatment. I mean, when I hire an associate, I would just say, we do one treatment plan here. One, period. Because I don't want to be asking if you already have the evidence to send to the insurance company to get the crown and they're going to cover it and the patient's not going to be out that much, do the crown. Why not? Why are you?
Yeah.
Their time has to be more valuable. I think we have time poverty in this company like nobody's business.
Okay.
But yeah, you definitely have to train the assssociate. With like all of that, because they don't learn that anywhere.
No, and I went off on like a massive tangent here. So like I went off. I think this is. I went on a crazy tangent on this one. Sorry, that tends to happen to me. I tend to do that.
Your tangent's good.
But reel me back in, Alex. Yeah.
All right, so we're talking about hiring. Yeah,
right.
You have an actual problem here.
Yeah, and where were we? Yeah. So going back to that point on it. So he's going to be coming in like a week or so. From my end, and I'll give you a little bit of background on mine, like, I just like, kind of like your 67-year-old friend, I'm like the, younger version of that, where like, I'm comfortable doing the dentistry I want to do. I'm not going to do implants. I'm not going to end up doing endo, right? Like, I've hired people to do that. So I'm looking for someone who can do more of the super GP stuff, right? Is what I'm looking for. So this person, I believe, has like more than a few years of experience, right? And wants to do a lot of complex stuff. So that part seems appealing or nice to me as well. Mm-hmm. I guess what other things from like an owner perspective do you think we should be like, what else should we be asking these associates, right? Like what do they kind of want? Like, I guess my point is, like, do a lot of them want like work-life balance? See, I can't even say it right because I think it's stupid. But work-life balance, or like are they looking for just, they want to grind it for a few years? Like, my associate that I have now, he's great with stuff, but he takes a ton of time off, right? Like, every month he's taking like we're open like Monday, Wednesday, Thursdays, and like once a month he's gone on a Thursday so he can go skiing. So I found that he really values time, right? Like, he wants to just take time off and live his best life, right? Alex and I aren't like that as much. Like, ours is more of like, we just want to grind, but then we also wanted to be owners of the practice, right? And just hustle and outwork for X amount of time, and then maybe not have to do that later in life, right? And just kind of have a little bit more freedom of what we wanted to do. So what do you find is appealing to, I guess, generalizing associates nowadays?
I ask them that, what are you looking for? First of all, these guys come out of school in enormous debt. So I think a lot of it is make money. How can I make the most money the fastest to get this boulder off my shoulder? That would be the number one thing. Occasionally I'll have people ask about how much time off I can have. They're really educated now about fee-for-service and PPO and HMO and like state stuff. So they want to know, what kind of patients are they going to see? Am I going to see the big good cases, or am I just going to be, doing state stuff? If you're looking for somebody who is like a super GP, one of the questions I would be asking them is, what kind of CEs are you interested in taking? Because getting to that better platform, it's going to take them to go somewhere, learn some things that are new, that are different. Not everybody's, even a couple years out, not everybody's coming in your practice knowing how to do that perfect graft after they do the extraction. And you may want to send them to do better grafting so it stays longer, because somebody may not have the money immediately to do the implant right away, so that you don't have the bone loss. Like that sort of stuff. Like, what are they interested in? Do they want to do more CEs? Is work-life balance important to them? I mean, you're not really allowed to ask about age and family and that sort of stuff. But I would say, like, what's important to you? Is money important? Is family time important? Is vacationing? Be honest with them, because you are managing expectations, and they sometimes don't know till they get in the seat. And the other thing is, I always tell them, whether it's a working interview or a shadow, you need to go see what a day in the life of that practice is like. What are the assistants like? What's the quality of the front desk person? How does everybody interact with the doctor? I know people are on their best behavior, but what does it appear like? What is the equipment like? Because this is what you're going to be practicing with. I mean, are they following OSHA protocols, or are you going to end up with an Explorer or Scalar or something that's got crud on it? I mean, you really want to make sure you know what you're signing up for before you get there. So a visit to a practice, and I would want maybe more than one when it's not so busy and one when it's jamming, so you can get an idea of like sort of get your nervous system ready for what's coming your way.
And I can just think of, so one red flag I would have, God, this is just me being cynical about it.
Is it the same red flag I'm thinking?
You tell me. I'm gonna say mine. So I agree with what you're saying. I think that's all good. I think you should definitely shadow the practice, even on a busy day and not busy day. That's pretty smart, because then you're kind of getting both sides of it, right? I would, if that associate or potential candidate ever muttered the words that they wanted to be compensated for that, I would never hire that person.
Right.
Because I would right now be like, this person literally just, they only care about money. And if they're coming in and saying, like, for me watching, I want to be paid, they don't see this as a relationship where they're getting value. They see it as a relationship where I'm getting value from them and they're more important than I am. So if I heard that, I would be a super hard no.
Yeah, that's a good point.
All right, what was your red flag? It was
My red flag was if they come in and during the interview they're asking about time off. Because, like, to me, like, that just, like, makes my blood boil a little bit. Because it's like, you can't have it both ways. You can't pay down your debt and want time off. It's one or the other. So it's either you're making money or you're working somewhere else, or like working as an associate in like a corporate office or something that then you're just a number and you can like put in your time off. No one gives a shit if you show up or not. Like, then that's what I don't know, especially in the beginning. Like, you can't have the expectation of like, I don't know. That's just me. That's super red flag for me if you came in during an interview.
Well, I like 10 times just tried to interrupt you during it, right?
Sorry.
Like we talked about before. Stop. And it goes to when we were selling. We're finding too, like with either, like, because we sold our practices a few years ago, right? So we'll talk to people who are looking at selling their practice. Mm-hmm. And I feel like they always want the best of both worlds. They want to sell to a DSO, get out in 2 months, and get a crazy high multiple in valuation.
Oh, they want the high multiple and no tie.
They want it all, right? And I think that's what we all do too. Like the owner wants the perfect associate who's gonna, never take time off, gonna accept 20% production and work really hard, right? And then the associate wants to get paid 50% production, and they want to take whenever they want time off, and they want 100 new patients every month, and they don't have to do anything for that. It just comes to them. So I think
like a massive disconnect.
I think the problem we all run into is just, and I don't know if it's like because it's in our head or we hear about one dentist on social media who has the perfect, plan for everything, is there's such a disconnect between expectation and reality for everyone, right?
Like even in dental school, like it was like trying to find that retiring dentist that would mentor you. It was like a needle in a haystack, but like we were all told, but that's what you have to look for.
Everyone,
that
if
is
you
the
went
practice.
to our school, like 50% of the kids were like, "What are you going to do after graduating?" "Oh, I'm going to go work at a practice." Like they had their plan figured out, right?
I'm going to associate for 2 years, then I'm going to partner with this dentist who's retiring, and they're just going to like split it with me, or I'm going to buy it or whatever. And it was,
and they're probably going to give it to me for free because like I'm nice and they like me. And
but the valuation would be from like when I started, not how like when I like increased the value. Yeah. Like there's all of these things that we're just told. And it's like, what reality is that? Like, that's really hard.
So I think that's a big problem. And I don't know if you see that too, is like, there is always this big disconnect. And I think that's why, like you were saying, you just need to on the front end, like Alex says, just like rip the Band-Aid off and talk about what the actual numbers are. Like, don't do, like, when we all are dating, right? Like everyone tries to show their best version of themselves like on the first date. But I feel like things would be a lot more successful if you just shared honestly what was going on. And I feel like we need to have that approach when we have associates, right? Is like, you don't have to say like your worst things about yourself, but like don't overinflate yourself because it's gonna come up at some point to haunt you, right? Or kick you in the ass, right? When you're like, oh no. New patients, we get 100 new patients a month. You'll have plenty, but like in your head, you get like 40, right? So like, don't lie about shit.
Yeah. Can I jump into our rant?
We all know Eric wants more friends. If you're enjoying this episode, share the podcast and then tell them to DM Eric so he can hit his quota of 1 new friend per day. Now back to the episode.
So the rant is what you're saying makes so much sense. And I see so many people. I will tell you, the level of arrogance of doctors coming out of school is insane. When I get on the phone with them, I'm like, you got to tone this down when you're talking to XYZ doctor. This is a really humble, meek dentist who's really, really nice. You're going to learn a lot from him. He does $1.5 million in his practice. He wants to get to 2 million. You're the, bolt to that. He's going to show you reports and talk to you about stuff. And I think when you show them your reports, not your P&L, but like how much dentistry you're doing and what your top 10 procedures are and all the things, I think it gives you a lot better rapport with that person than if you're just showing them nothing. Do you know what I'm saying? I think the one thing that I hear from second and third year out doctors is, I have no idea how much money I was making. I never saw a report. And so
yeah, I'm sure pay thing. You could do a whole episode.
It's
on
not
how
even a pay thing. It's like I can't think of the word, but it's like you're managing their expectations and you're transparent. The transparency, I think, hurts people. And then a lot of doctors, just new dentists, come out exactly like what Alex says. Someone told me that if I go mentor with someone, in 2 years they're giving me their practice. Let me tell the world, no one is giving you their practice. They have a wife. The wife is going to tell you, no, you're not getting this for free. In the case of those older doctors, mostly it's a wife. Sorry, I'm not trying to be gender, whatever, but more of the older doctors that are 60 to 80 have wives. So it's just a thing.
Yeah.
But their family, if they were a good, honest person, they're going to want to leave inheritance for their family, whatever it is. No one's just giving you their practice. You have to work for it. You're going to have to take a loan out for it, whether it's through that doctor or through a bank, doesn't matter. There's going to be an exchange here. No one's just giving you something. So if somebody told you that in dental school, that is actually never going to happen. That is probably part of the reason why, if people want to really pay attention, DSOs have sprung up, because they have given multiples of paying for very successful practices over a period of time more money, period. We live in a state of greed. I don't mean that to be obnoxious. It's a reality of the function of the society we live in right now, period. But as a new grad, you should be asking for reports. As an owner, you should know that it is okay to show someone your Dentrix, EagleSoft, Curve, whatever software you're using, report on your practice. It's not going to be that accurate, because we know that there's stuff in there that might not still be in there. But show them what you're making for procedure.
Yeah. So to cut you off there, what type of reports? Because in my head, I know the reports I'd want to see as an associate. But if you're an associate, right, and what reports would you say, like, I don't know, the top 3 reports you want to see in their PMS system to get a gauge if, like, all right, this is going to be a good fit?
I love when you set me up. Okay, the top 3 reports I want to see. I want to see dental to hygiene report. I want to make sure your hygienist isn't making 40%. They should be under 25. So as a dentist coming in, I want to know that there's going to be dentistry coming my way. I want to know that I'm going to see some hygiene patients, but I'm not going to be spending 40% of my day seeing hygiene patients not getting paid for it. Number one.
Are you
so what report is that?
Yeah. So are you saying, just to clarify, are you saying if an office is doing $1 million in production, you don't want more than 25% to be hygiene production?
Yes.
Or you don't want the dentist to... Okay, cool.
I don't want my hygienist doing 40% of the production. I want...
Yeah, because then it leads you to believe that, hey, maybe there's not a lot of dentistry here, and this is more of like a hygiene mill, and I might become that hygienist.
Correct. Yeah. So that would be one report I absolutely want to see. The second report I want to see is a practice analysis. I want to know what the practice is doing. What procedures are you guys doing? What are you making? What are your top 20 codes? What are you coding out? Because if I'm coming to work for you, I want to know what I'm going to be coding out most. And that's going to give me a
you totally just bundled one big report into the broad phrase of analysis. So within analysis, let's do that, because that's a good idea. You're saying...
top 20. top 20.
Top 20
procedures.
Build out.
I'd want to see what's been referred out.
Yes and no, because the next thing I'm going to tell you is going to be an interesting one that it's going to throw you guys off.
All right.
I want to see the treatment diagnosed unscheduled report. I want to know if I'm a doctor and I come in there on a Saturday and start making a couple phone calls to get some of these people in, that there's money sitting in your practice that I can go attack at my 35, 36, 34, 32, 30%. If I'm going to put a little extra, and if you're a dentist and you really want to make money, that would be what I would be doing. I would want to go see, there's money in every practice in the United States. Somebody diagnosed something, somebody didn't get it done. There's a 50-50 chance that person either got it done or forgot about it. And nobody's front desk is infallible. I can assure you. Yeah. Every practice I look at in the country, there's $500,000 to $1 million there.
Okay, so what are your thoughts on this? Because I go back and forth on it.
Are we thinking the same thing? I hope so.
Okay, now you can start, Alex.
No, because there's like two sides to every report almost. It's like, what is it actually saying? And it by looking at numbers, it doesn't tell you the full story.
Right.
So like with that report, if you're looking at, treatment not scheduled, like diagnosed but unscheduled, okay, is that just the dentist that's like not pushing? Maybe the dentist's philosophy is we'll watch a lot of stuff. And that's really hard to go into when for the last, 5 years, 10 years, 20 years, the patients are like, no, this guy's been watching it. Why do you want to do this now? Right. So it's about like the patient makeup. It could all like, I'd want to know, well, what are the notes? Like, was it presented? Or all these patients like cash poor? Like they can't do anything? Was it presented to them and they said no? Or was it like the person at the front is just like terrible and is like, oh, we'll do it later, like whatever it is. I think there's a little bit more.
No, I think it's like understanding the why, because that's what I was just about to say, similar to you, Alex, that if I saw a ton of unscheduled treatment, at first glance, I would probably be like, yes, there's lots of opportunity. I've learned, though, that sometimes we equate opportunity with, like, easiness, and it is not. Yeah. Because, like you said, if you're coming in as an associate, I don't know what I'd rather want. So maybe we could debate this for a second. Okay. I don't know if I'd want to see a lot of scheduled treatment, not a lot of unscheduled, and a lot of new patients, right? Probably going to be like, okay, good. This is an efficient practice. Shit doesn't fall out the cracks. I know that the front probably converts, right? I don't know if I'd want that, or like you said, if I'd want a lot of unscheduled treatment, because that may be, I may have a 10% chance of converting those people, right? Like if my team sucks, and that's the reason why, or their team sucks, me coming in there as an associate, I'm not going to be able to really influence that a ton, right? I can influence when I'm in the room, but like it's not my office. So like I'm not training the front, right? Yeah. So is it that their systems suck? Do I want to join a practice that has shitty systems? And so there's kind of like two sides, like you said, to every story
and even
there.
The other report with like the how much hygiene is out. Like, it could mean that, there's just that dentist is not diagnosing. They just do a lot of hygiene. You might become the new hygienist or do a lot of cleanings. Or it could be they're really at a capacity issue and they're like, I can't schedule this. I literally need you tomorrow to come in and do all this dentistry. Right. So there's a little bit more back.
So I get it. And
it's so hard.
I think it's that point where it's like we almost need to create, or maybe you can create this. I know you have a book you came out with. I have an idea for your next book. So your next book is going to be like a report, and it's like it takes you down, like you look at a number and you're like, okay, if I just looked at this number, it shows me this or this, but now because I have this information, now I need to look down here and go down this path and see if like this matches with this, and then I need to look at this path, and you almost need like a flow chart of when you're given a piece of data, how that affects so many other things, because it does. And sometimes we see one thing and we say new
patient report. Sure, I'd love to see what that is.
Right.
Oh, I have 50, 70 new patients. Well, what's the referral?
Right.
Are these Medicaid patients?
Right.
That's been a lot of people.
Or there's another dentist I was talking to as well, and he was saying, sorry, I am totally taking over this for both
totally
you guys. I'm just very into this. I just have a lot of thoughts. Is they were saying, oh, I'm going to sell my practice, right? And the broker was like, oh, this practice is getting, say, I don't know, 50 new patients, but they could be getting 200. They're just so busy they can't see a new patient for 4 months. And I was like, well, then that's a shitty run practice. Like, open up more days, man. Like, you want to sell your practice? You don't know how you can get more money selling your practice? See more patients and do more.
Well, not even selling,
right?
just production.
In general, but for this situation where they want to do that, you're going to do more production that way. So it's like, why aren't you doing that? Like,
there's just so many questions, and as someone coming out of school doesn't know any of this. I never knew any of this.
Right.
And it's like, it takes you to be in it to understand, okay, where is this actually coming from? It's not just as simple as this number looks good, or this dentist says, yes, I need an associate.
Yeah.
It's like, oh, there's a lot more.
You just need someone who you need someone who can be an advocate on your behalf, right? Like, when you don't know information, right? Like, if I don't know how to lift weights, I say I want to get, or I don't know, I want to go. We were talking to another dentist who does Ironmans, right? If I was like, I want to run an Ironman, right? If I just try to do it myself, it's going to be terrible. I would need to find someone who's either a coach or an advocate, or can help at least lower my my ignorance barrier to understanding something and make it go faster. So I learn quicker. So I don't know. If I was an associate too, I think I'd try to surround myself with people who know the answers to the questions that I don't even know, and then they can help guide me. Then you just got to trust someone.
I think one of the things I was trying to demonstrate by saying you want to know what that hygiene report looks like is that dentistry is being done more than just hygiene. I mean, I don't know how you guys do your new patients, but I think a doctor should see a new patient before the hygienist does. You do all their x-rays, you get them in, you have a meeting with them, you tell them what needs to get done before they have that hygiene appointment. Their mindset is already around hey, oops, I've got a couple fillings I got to get filled, or I got to get a crown, or whatever it is. You've already met them. You don't even need to go see them at their hygiene appointment because you've met them, you've looked in their mouth already, you've got a bunch of evidence to predict or to diagnose what you need to diagnose. Hygiene's just hygiene at that point. I mean, essentially.
Yeah, so we've done that too. I think that works. We used to when we started, it was always on the doctor's side, and they would do the whole thing. But now what I've been doing, it's some laziness, is I've been well, the hygienist has an opening, right? And I'd rather if there's an opening, I'll throw the new patient to the hygienist. If there's a patient that needs a crown, right? I'll do that just because I'd rather do the crown.
But
right?
you already know how to do this.
Yeah, but we would also split the appointments. So we would also do it too where the comp exam part for 30 minutes was, assistant takes x-rays, take intraoral photos, I go in, I talk to the patient. Maybe I'll even do the perio diagnosis on them, right? And probe and then determine what type of cleaning they need. And then I'll just send them to the hygienist after if we can split the appointment, right?
Sure.
I don't mind doing it that way. I think
but that's
fine.
you. But we're talking about
No, let's talk about me.
Yeah, okay.
No, yeah.
So for associates, that is I think a great way of doing it is seeing new patients on your schedule the whole time. And if it works out and the person wants to do same day, or there's some treatment that comes in, okay, fine, push the cleaning to the hygienist if it's possible. But you learn so much more by starting and finishing with that patient. There's shit that I've looked as I'm cleaning a patient, I'm oh shit, I missed this. I missed this buckle thing. Add that to the treatment plan. That I probably would have overlooked, earlier, but because you're in there kind of cleaning and going through things and stuff, it lets you have time to think. It lets you go a little bit slower. I love that for new associates.
Because on a new patient, it's the first time you're meeting them. So when someone's in your recall system, the odds of you finding 3 buckle spots, right, aren't as high because you probably would have seen it on the first one. That first visit is really you don't know how long. They could have told you it's been, or could have told you I've been in 6 months ago, but it was 4 years ago, right? You've never established any type of rapport or any type of I don't know the right word of it, but you haven't actually seen them. You haven't looked in their mouth. So odds are, Alex was saying, you want to spend more time because you're probably going to find more on that first visit.
Can I?
Yeah.
Can I wrap it up in a bow for you two?
Yes.
Because I love you. Ready for why you want to be the first person they see in the practice? Because your hygienists are going to come and go. Why have that person be the first person they're having a relationship with? And what could happen is they could follow the hygienist where they go and not have you be the point of interest. Period. End of story. If you're the first person they're dealing with, it doesn't matter who the hygienist is. And the way hygiene is now with everybody, again, did I say something about greed? Yeah. Hygienists leave for $5 more an hour to go to the next guy It's going to happen to everybody. It's just a formula of the economy right now. You want to be the person that person connects with first. If they connect with you and you're cleaning their teeth first and they feel comfortable, they're going to tell you a lot of things. And then they're going to be, at their next hygiene appointment, hey, I enjoyed so much. Can we talk about whitening, straightening? Oh, I'd like to maybe get a veneer here. I'd like to do this. They're going to feel more comfortable with that doctor after they've met with them first to discuss what they want to do in the future that might be ancillary and not health worthy, that you're going to make more money by accident. If you're connecting with a hygienist and you are a revolving door of hygienists, guess what? You're not keeping people. The loyalty isn't there to you from the patient. It's to whoever. You want to establish loyalty first. You see the patient first.
Yeah. And I think last red flag, if there was an associate that came in and I said, hey, there might be some hygiene. And they're like, oh, well, I don't do hygiene or I'm not doing cleanings. Big red flag. I would absolutely not hire.
Yeah, I don't want them to have to do it.
Yeah,
right?
That's not the intent. I don't want you to.
But if you're not going to be a team player and at least like help out in a pinch,
and you can tell by their like body language and stuff, and it should absolutely be addressed in the interview. If you do expect
100%.
them to do hygiene every so often, I was doing hygiene like.
Oh, I was
you just do it. Like it helps the office. Sometimes you're double booked or whatever, and you're just like, I'll just do this cleaning. It's fine. No big deal.
I'll tell you a little secret. I do not like going to the dentist. This is why I'm a good recruiter, because if I can talk to somebody and they can talk me through putting a needle in my mouth and then drilling my mouth, I can hire them anywhere and they'll be good. And part of that is the same thing about what you're talking about. There's a level of comfort. This is your mouth. Your mouth is everything. It eats, it communicates, it's everything. Somebody's now touching it and peering it, whatever. This is why you want to build a rapport with that person too. For that very reason. Someone's doing stuff in there. And the newer dentist, I tell everybody that's a new dentist that's going to go work for someone, expect to do hygiene. If you're not already mindset to be there, you better tell them it's okay. Exactly what you said. You better tell them it's okay day one that you're going to do hygiene, see new patients. My doctor, when I first met him, he froze me up to do my cleaning because I've got a really uncomfortable thing going on over the gum between 13, 14, and 15. And I just want to jump out of my skin when they start scraping it. Even if they use a Cavitron, it doesn't matter. It kills me. So I have them freeze that side of my mouth now. And it's not a root canal. I have a root canal in one of the teeth. I just have a really deep pocket there and I'm miserable.
Yeah.
And I would rather be frozen to do my hygiene. And guess what? He froze me and he saw a little filling. So he did everything all at once. Bango, done, out the door. I didn't have time for them to even give me a treatment plan to do it. They just did it.
Mm-hmm.
Yeah. Yeah.
So I think that there says a lot about your efficiency and care to get something done. And I don't know how far you guys booked out to see either one of you in your offices. 6 weeks? 2 months?
Booked out? We try to stay.
No.
You haven't been clinical for a while.
I don't know how to do it. Yeah. It's been a few years. But no, because as soon as you get, so we were always in the mindset of growth. It would never be okay if someone was booked out months and months to see us. We would take the actions and be like, all right, what do we need to do? Open more days, open more hours, open more chairs.
That was like 2 to 3 weeks, right? Like if we were consistently booked out a few weeks, then it was like, now it's time to pivot. Do we need to open another hour? Do we need to open another day? So we never let ourselves get overbooked.
Yeah.
But that was just because we were coming from the mindset of how can we grow the practice? But yeah. I feel like we could talk for like 6 hours on this.
Oh my God, we could totally talk about that.
Yeah, so we'll all have to have you come back on and kind of just go through because we can just go on tangents for forever.
Yeah, we'll have to figure out if you've hired your associate, if that's worked out, or kind of go through. Yeah, let us know how like the
and let me know you build out that flow chart because I could use that. That'd be helpful.